The first self-assessment we're going to do is active range of motion of the low back, the hip, and then the knee. For our hamstrings, they start just underneath our glutes, which is like attaching onto part of your pelvis, which is very intimately related to your low back. And then they connect on either side of the knee. So your knee joint affects your hamstrings, your hip joint affects your hamstrings, and then since they attach onto your pelvis, your low back and your pelvis range of motion, all of these are impacted with your hamstrings. So for your low back, first we're going to do a forward fold. Knees are fairly straight. How far forward can you fold? And then coming up. If there's any pain, please stop and just note the angle that you're able to get to when you start to feel discomfort. This forward fold uses both hamstrings, and so we're going to isolate each one. Take a half a step forward with one leg. We're going to bend the opposite leg, so I'm bending my back leg. I'm going to pop my booty forward or anteriorly pelvic tilt, and then tip forward from here. This is usually more intense for most people. So where can you get in this position without having to round your pelvis or your low back? How far down can you go? Capture that angle and then switch sides. How far down can you go on the other side? And come up. For our low back extension, we're going to find a neutral pelvis. So we're not anteriorly pelvic tilted or posterior pelvic tilted. We are nice and neutral. And then from here, we will lean back and then come up from there. Once again, noting if there's any pain and how far are you able to get into that range of motion when you start to experience pain. We are then going to move on to lateral flexion. So we'll have what I call penguin, tip to each side, feet together, legs straight, and then feet together, and we're going to rotate side to side. For most people with hamstring injuries, it's the forward fold is the one that bothers them. So if you're not having any discomfort with any of the other ones, that's just fine. We're just checking in to see how does moving our low back and pelvis feel in relationship to our hamstrings. From here, we're going to move on to hip range of motion. So if you need something to hold on to, that's just fine. Turn to one side so you can assess one hip at a time. How far up can you lift? How far back can you extend? So we have flexion and extension. And then we're going to turn to the side and we're going to go into abduction, which is moving away from the midline, and then adduction, crossing the midline. Then we're going to go into rotation. We're going to start with a straight leg. So bringing one leg out in front and externally and internally rotating. Do you have any discomfort in this movement? And then if you flex your leg, do you have any discomfort with internal and external rotation? And then our hamstring also has the ability to move our knee. So we're going to just assess how that's feeling. Knee to butt with your hip in neutral and extending. Does this bother your hamstring at all? And then if you go into more of a hip extended position, heel to butt and straighten, does that bother your hamstring? How far can you go? And then if you lift your leg up, bend and straighten, how does this range of motion look and feel? Perform all of the active assessments on both sides, and then we'll move on to the next step.